I'm Dr. Snodgrass, that's Dr. Bush, and we want to talk to you about what to expect around the time that your child is having surgery with us here at Park Urology.
So usually this kind of starts a few days ahead of time where the hospital will call you with kind of an approximate time to expect to be here at the hospital for the surgery and about what time to stop eating and drinking. And then the night beforehand, you're going to get another phone call, usually on your cell phone from a number you don't recognize. And that's our anesthesiologist who's calling with the exact specific times of what time to be here and what time to stop eating and drinking. And that's because it's safest to have an empty tummy for the time of surgery. So the next slide will show you, in general, kind of the feeding recommendations for folks who are going to be undergoing anesthesia. So no big solid heavy things like bacon or french fries after midnight, but some of the lighter meals you can have up to about 6 hours before surgery. For babies, it means infant formula they can have up till 6 hours before surgery. But the nice thing is that they can have clear liquids like apple juice, Pedialyte, water up until 2 hours before surgery. And then for breastfeeding moms, breast milk doesn't curdle quite the same way that formula does. And so moms can give breast milk up until 4 hours before surgery. So that's all nice because it's not quite like adults where it's nothing after midnight. You can't drink or eat anything. For babies and children, the stomach processes things a little bit different. And so there's not quite so much time for them to have to be without any food or things to drink and eat.
So on the day of surgery, we'll just discuss in the different age groups of babies and toddlers, children, and then the older folks, teens and adults. So the youngest babies really oftentimes don't need a pre-medication. They leave their parents easily, and the anesthesiologist carries them himself back to the operating room. So that's a pretty calm
That stranger
process.
anxiety doesn't tend to really happen until 9 or 10 months or so. So kids under that age don't necessarily need anything to have any of that separation worry from mom or dad. So they don't tend to need pre-medication. So they go back with the anesthesiologist, and then after the babies are asleep with a little bit of laughing gas sort of circumstance, usually then an IV is started and pain medicine is put in beforehand. So the babies are asleep, so they don't feel any of these things that could be painful to them because they're asleep during that time.
For older kids who will have some separation anxiety, they will get a pre-medication, a liquid to drink, which will make them less fearful of things.
We
and
call it
easier to go
silly
back.
juice, so that's kind of what the nurses and the anesthesiologists tend to refer to it. And it helps. It does make some of them a little bit silly. Others, they just kind of get relaxed and they have it much more calm so that worry of going away from mom or dad doesn't really happen, or at least if it happens, they don't recall it. And we think that's a really important aspect of things. We've traveled around to other countries, for instance, where they're not so vigilant about giving that medicine, and the kids can be really terrified and frightened from having that separation. And so we think that we don't want them to have any associated bad feelings with their day of surgery. So that's a really important component. And then just like the youngest babies, after they're already asleep, then they get an IV started and they'll get a numbing block in the area that will be performing surgery, because we want everything to be numbed up before we get started. That really allows them to have much less pain and discomfort during the surgery because everything is numb, and allows them to give less anesthesia because they're comfortable during the surgery, and really helps them if we have them use a long-acting medicine to help get through the recovery and maybe even the car ride back home or to the hotel, depending on where you're staying. And then by that time, babies are awake and eating, and the younger kids too, so that they can start having routine pain medicine that you're going to give, and we'll talk about that in just a few minutes.
Older teens and adults are more likely to have the IV started in the preoperative area, and then if they wish to have something to take the edge off, the anesthesiologist can easily give it in the IV before they go back to the operating room. So in that case, it's a little bit more like typical adult preoperative care. But once they're asleep, it's the same thing. We want to numb the area where the surgery is going to be. We want to minimize the amount of anesthesia overall that a patient of any age is going to have. And we want all of our patients, regardless of age, to wake up and not be in pain after the surgery is over with.
We are huge believers in numbing blocks of pain medicine. If you're having surgery anywhere on the body, we think that it really is an important component to doing better in terms of your entire surgery. So that kind of gets us through and up to the time of surgery, what to expect beforehand and during the time of surgery. So now let's talk a little bit about afterwards.
So when this is going to vary some by age too. So infants less than a year of age have excellent pain relief just from taking Tylenol and ibuprofen, and we have them take that on a regular scheduled basis. So you don't wait until your child is crying and hurting. We have you 3 hours when we see you in the postoperative area before you go back with your child. We tell you, okay, 3 hours from now, we want you to give them their first dose of Tylenol, and then 3 hours after that, you'll give them ibuprofen, and you will alternate Tylenol and ibuprofen for that day, and usually for one more or so days. And then after that, you can give it more or less as they need it. Sometimes parents ask if it's okay to give kids these medications, and it is. For postoperative recovery, infants and children can have Tylenol and ibuprofen. And again, this is sufficient. This is very good pain relief. In fact, in many ways, it's better pain relief than when you mix in narcotics for these kids. So this will work. So that's the youngest kids. And then also we mentioned...
do have folks that ask, though, do they need to wake their babies up from sleep? And the answer to that is no, you don't need to wake them up. But, if they're awake for a routine feeding or, because they're starting to get uncomfortable and they wake up from that, then you want to have the medicine that you're going to give them kind of ready and prepared to go.
The only other medication that we give to the youngest children is an antibiotic while the catheter's in to reduce the chance for getting a urinary infection, but no other medicines. Some of you have read on the internet and all about bladder spasm medications, which we'll talk about in a minute, but the youngest children don't really seem to need that, and if there was an exception, we could always call it out to a pharmacy if it was necessary.
So now if we move forward to still younger children, but over the age of a year, then we kind of shift things a little bit. So we kind of switch over to some Tylenol with some narcotics called hydrocodone in it that we'll plan to give 3 hours after surgery. And that's just because some of the older boys will perceive a little bit more pain and may just need a little bit, something a little bit stronger to take the edge off. So that's a medicine that the technical term for is called Hysit. So you'll plan to give that 3 hours after we're done, then 3 hours after that again with the ibuprofen, which is a really important component of things. And so for the first 2 days after surgery, you'll alternate the Hysit with the ibuprofen. Now here's where we'll also do the antibiotic twice a day to prevent a urinary tract infection. So this is a really low dose of an antibiotic. It's not a whole body kind of knock things out antibiotic. It's a small dose to mainly prevent urine infection issues because it's highly concentrated in the urine. So we do that. And then after the age of a year, there's some studies that boys will actually require less pain medicine if we give some pain medicines for bladder spasms. And so we'll talk a little bit about what a bladder spasm looks like in a second, but that will be either 2 or 3 times a day, depending on the age of the child.
So older kids are, again, now moving up to teens and adults, they're going to need a narcotic after surgery for sure. And so, but now they're taking pills rather than liquid. So the name of that has changed. It's still Tylenol with hydrocodone, and they're still going to take that after surgery and then alternate that with ibuprofen. These kids are going to be in the hospital though the first evening after surgery, so they'll get medicines there, but when they leave the hospital, then it will be alternating the narco tablets with ibuprofen. Still going to also be on the low dose of an antibiotic, going to take a pill for bladder spasms. And then one more thing, teens and adults will have erections at night. And there's no medication that we can give that will take away those nocturnal erections. They don't hurt the surgery, but they hurt. And so we have found that giving a Valium tablet at bedtime seems to take kind of the edge off of that too. So it doesn't stop those erections, but it just seems to make the teenager or the adult less bothered by it. So we recommend that too.
So as he mentioned, the teens and adults, we do want them to stay in the hospital overnight, and that's mainly for bed rest. The blood vessel, the penis is obviously bigger, so there's bigger blood vessels in the penis and the scrotum. And so really kind of keeping still and letting all of that settle down after surgery is, I think, a big help. And so they'll be really pretty still in the hospital overnight. And then even going home or to the hotel for the next day or so, we'll still want pretty minimal activity at that point.
Yeah, and then they also ask about, well, when can we bathe and shower and things like that? So you can sponge bathe immediately, for the next few days. And then we allow you to start showering within a few days too. So we have specific postoperative instructions for all of these things, which you can check on our website, but we're just kind of giving you an overview of that. Certainly when the day comes to take out the catheter, and if the bandages are still on, it's really good to soak thoroughly before that, because you know how dried blood and stuff kind of sticks to the skin a little bit, and this just makes it easier for the bandages to come off.
So for our out-of-town patients, we usually will send the prescriptions to a pharmacy the day beforehand when we're seeing you in the office. So essentially we have to have a wait for you or your child, and then we can send all the medicines. So we'll send those, if you click, usually to a Target pharmacy that's just like a quarter of a mile away, so very, very close. And that's also a place where you can pick up, any over-the-counter Tylenol or ibuprofen at the same time. If you need some Aquaphor ointment, which we'll talk about maybe using once the bandages fall off, you can pick that up, and any snacks and things at the same time. So that's our usual thing that we do. For our adult patients who might be staying alone, for instance, at a hotel room, then that day before we'll also want you to pick up maybe some food and some stuff to eat for the first few days after surgery, so that you can really minimize, not having to get up and go to the store, etc.
Parents and older patients are always worried a bit about the catheter too. What's going to happen there? And first off, not for every operation we do. For example, when we just close a fistula, we don't use a catheter. But for most of the surgeries that we're performing, there will be a catheter, and it'll be in for either 1 to 2 weeks, depending on exactly what kind of surgery that you or your child needed to have done. The youngest kids will do great just putting it into their diaper. We don't do double diapers. We don't object to it if you want to, but it's not necessary.
And it's twice the cost.
Yeah, we think it's best just to keep things as simple as they can be, and so that works fine. Older kids, don't want to be in diapers or pull-ups, so we rig up a leg bag situation, and the nurses show you how to do it. So that's all of this is
and
easy
usually
to
our
do.
cutoff for that is around 7, so less than that, especially for boys. They may have been used to wearing pull-ups at night, for instance, and so 4 and 5-year-old kids, even if they're totally toilet trained, they don't do very well being attached to things coming out of their penis. So it's actually better for them in terms of mobility to just go ahead and put them in pull-ups even when they're totally toilet trained. It's really when they get to be that more older school age where it becomes an issue, and they're going to tend to be a little bit more careful. We are big believers in not using those long, there are bags that come on a long cord that look like this big long tail that kind of lay over the side of the bed, and those sorts of bags in kids are not good combinations. In fact, we have an adult patient who had a problem because when he was 5 and had his Hypospadias repair, the surgeons left this long bag, and essentially his dog got tangled up in it and ripped the catheter out. And I can only imagine the pain and
Can't
the
we
blood.
all see that?
Yeah.
Yeah.
Just bad
don't do that.
combination. We
Yeah.
don't do that. You don't need it. And even our teens and adults, we tend to just, for that same reason, go ahead and put on a leg bag. So that's something that can go underneath your shorts and pants, just be emptied at regular intervals into the toilet where people won't see it, and it's not an issue. So we try to make it very simple where it's not a complicated process. It's either draining into a diaper or a pull-up or one bag that you empty, and the nurses will go through with you how to do that on your day of surgery.
All of these are really easy to take out. So many of you are traveling here from outside of Texas, and many people are worried, well, do I need to stay in the area until the catheter comes out? And the answer is no, you don't. In fact, we have some YouTube videos showing how easy it is to take the catheter out. And so you can do this yourself, or a nurse neighbor can do it, or sometimes the pediatrician's office will be happy to do it. So we just don't find any of this to be a problem. And the other thing we want to say is that sometimes we tell you we want the catheter to stay in for 2 weeks, for example, and on day 10 it comes out, and that's okay. We don't worry about that. In fact, we probably tend to leave the catheters in slightly longer than we need to, just out of caution. So if one comes out early, we almost never need to have one put back in. Almost never.
All right, but one thing to know about when it comes to catheters, at least for kids over the age of a year, and especially teens and adults, are what are bladder spasms. So I like to describe bladder spasms like you would think of any muscle cramp, so like a bad Charlie horse that you might get in your leg. And you really want to try to address the bladder spasm discomfort in the same way that you would a muscle pain. So if you've had kind of a Charlie horse, you know that rubbing it or putting a warm compress on it is something that can sometimes help. You can do that same thing. Just kind of gently hold the belly area, kind of, and below the belly button is where that discomfort tends to happen. And what you may see is, your son will be up and about, day 3 or day 4 after surgery. They're feeling much better in terms of their surgical site pain, but they're out and about, and then all of a sudden they may hunch over and start crying. That's a bladder spasm, a cramp in the bladder. So giving the bladder spasm medicine on a routine basis is definitely something you want to do, because it's a muscle relaxant specifically for the bladder. And then ibuprofen tends to work a lot better for muscle pain than any narcotics do. And so as time goes on, you're going to move away from the narcotics completely and switch over to the bladder spasm muscle relaxant, what's called oxybutynin and ibuprofen, warm compresses. And then as time goes on, if it's been enough time after surgery, even soaking in a bathtub or putting that warm compress on there will help. Now, one thing to avoid, I think you were going to say,
is constipation. And a lot of people ask us about this too. If your child is old enough to be on a narcotic, if your child is on a narcotic, then they're old enough to need the bladder spasm medicine. And both of these have a side effect of tending to cause constipation. So depending on how old your child is, you can take some measures to avoid that. The gummy bear fiber things are available, or Miralax,
or prunes actually taste pretty good and work really well for the babies, for instance.
So there, it doesn't matter. We just mention it to say that yes, constipation can occur, and whatever remedy that you use to avoid it is fine with us. We don't find this to be a major problem, but we find both of these to be major questions that people ask. Yeah, again, because I think many of you have read some horror stories on social media that there are cases where children can be really bothered by this.
For sure. And if we're not addressing it, and if you don't know what it looks like, I think it can be a very scary thing as a parent. So that's why we wanted to chat with you a little bit about them. So go ahead.
Well, and then there's the question about bandages, the other thing besides catheters. So again, our general philosophy is keep this all simple. Don't do more than you need to do. And that's true with bandages. We put on pretty simple bandages, most of which will fall off by themselves. Now, if your child has more severe hypospadias and is going to need a 2-part operation, and after that first operation, we put on a little bit more complicated bandage that somebody's going to need to take off. And so our nurse can take it off next week. Some of you choose to stay in the area that long. But if you travel back home, again, this is not difficult, and we have a YouTube video showing it. You can watch it. You can show
Plus
that to the
a sheet
nurse.
of paper that we give
Explains
to
it.
telling you all the details about
Right.
it.
So you can make some of those arrangements before you even come, so you're not worried about that.
Now, invariably, we get questions and emails and lots of phone calls about bleeding after surgery. And that's because blood, especially in a baby, looks really worrisome. But we have to remember that in this circumstance, we have blood and pee, and it all mixes together. And just like, when you brush your teeth and you brush a little bit hard and you spit some blood into one little drop of blood from brushing your teeth too hard, when you spit it can look really gross in the sink. Well, that's how things can look in the diaper. Just a few drops of blood mixed in with some pee can look really, really worrisome and concerning. So it's very normal for the bandages to get coated with blood. They're going to get coated with pee. If they happen to stay on a few days, they'll get smelly. If you've ever left a diaper out, in a pail for 2 or 3 days, you know how stinky just the pee alone gets. So all of that is totally and completely normal. And usually dime size, quarter size, half dollar size spots of blood for a few days in the diaper is also completely normal. Okay.
Yes, we also have a website that we'll give you the password to access to look at some post-operative pictures to see, well, I'm worried about this. Oh, but it says here that looks just like this picture on their website, and they say that's okay. But really what ends up happening is we reassure all parents that almost never is whatever you're seeing post-operatively a worry. But you don't know that, and we know that you don't know that. And so if you become concerned about it, we just want you to call us, and we'll give you our phone number, and you'll text us a picture, for example,
Or
and we'll
email
look
it to
at
our
it
nurse.
during the day, and then we'll respond to you and let you know that, nope, that's what we told you, that's normal. So we don't want you to be worried about that. It's very unusual to have any kind of bleeding that's medically worrisome after this type of surgery.
There's almost never anything that we need to do, but if it is something you're worried about, one trick that I can tell y'all that we sometimes tell folks on the phone is, well, it's an easy thing we call the washcloth trick. So if you're worried about how much blood that you see, it's a trick. I think it's a trick.
Okay.
You're gonna fold up a washcloth in half and then fold it again so it's in fourths, and you'll put it in the diaper. Then you're gonna put his diaper on, snugly over that, and then you can just rest your hand on top of that and hold pressure. So you don't have to hold things tightly. You're just going to rest your hand on top of that, and then no peeking is allowed for 10 or 15 minutes, because if there's a little vein, for instance, in a prepubertal patient, all these blood vessels are so teeny tiny that just a little bit of pressure is going to stop something if like a little scab came off and it started things bleeding again. So the washcloth and then your hand over that with no peeking for 10 or 15 minutes will stop virtually all bleeding that is going to happen in that circumstance. So that's one thing that you can do. If that has happened and he's soaked through the washcloth and is soaking into the diaper on top of that, you need to give us a call, because that would be in a very unusual circumstance. About 0.5%, maybe 0.25%.
Yeah, maybe in a year one person
will have a bleeding
like
issue that needs to be addressed otherwise, but that's a very rare thing, and that's something that for the most part will happen shortly after surgery, and so we'll let you know what to do in that circumstance.
So for those of you who are going to have two-stage repairs, either for the first time surgery for proximal hypospadias, or if there's a redo operation for failed hypospadias surgery
that needs a two-stage repair. Some of those don't, but some of them do.
Right. So all of those patients are going to have that bandage for a week, that kind of
on
special
the outside,
bandage.
the one that comes off on its own, but a different inner special bandage.
Yeah, so what we're referring to here is the bandage that's going to need to be removed in 1 week. And then we want some additional care once that bandage is taken off. So this is the bandage again that a nurse is going to help you with. So once that's off, that that bandage is initially just putting a little compression on the graft that we've put there to help it heal. So once that's off, we want to help that graft heal by keeping it moist with Aquaphor, and we'll just have you, every time you change the diaper, or if you're older, several times a day, we want you just to coat the graft and the skin next to it, all the underside of the penis, with the Aquaphor, and we'll have you do that several times a day for the next few weeks. Then at a month after surgery, we're going to have you put some steroid cream in, and we're going to explain all this. It's in our post-operative instruction. We're just giving you an idea. We want the grafts to heal and be healthy, and the betamethasone, this steroid ointment, also helps. Wounds tend to want to shrink some. This is the body's way of healing, and we don't want that to happen with a graft. And we have found that by smearing some betamethasone ointment or cream onto the graft and onto the skin, it helps to reduce that. So we do that for a couple of times a day for several months. And that's the whole treatment for it. So it's very simple, and you have a role to play in just helping everything to heal in that regard.
But we should do a few things just to clarify. The ointment is not a hormonal ointment. It's not like testosterone cream. We've had other webinars where we've talked about why we're not big fans of that. So really its only purpose is to help specifically with that wound healing aspect of things. And there really aren't any other side effects that are known. It's not absorbed within the body. And so anytime there's a skin issue that we want to help make that skin as stretchy and supple as possible, that's a cream that we use. And it's that same sort of thing. If you've ever, like I've had some moles removed at the dermatology office, they're going to tell you to keep that area moist while it's healing early on to make it heal as pretty as possible. And so that's what we want to do for anything that we operate on in the penis. But I will warn you, there's a little check there.
I lost it.
I think if you go back, if you do need betamethasone, this wound healing cream, make sure you call the pharmacy first, because we found, at least around here, that the price varies greatly, like $50 at one place and $100 at another place, for instance. And so you want to make sure you call the pharmacy first before you pick that up. If it's around here, we can let you know which ones are cheaper.
And we're going to close with the same thing that we tell everybody that we see. Please don't panic. If you're at home and you're seeing something and you think this isn't right, or I'm worried about this, first off, it is really rare after penile surgery in children and adults to have anything that's a true emergency. Almost never. People don't really realize that if you rush off to the emergency room, that the doctors in the emergency room, they don't know anything about hypospadias or surgical recovery
what
and things like that.
What it's supposed to look like.
They don't have a
what
clue.
What labs may or may not need to be done.
Right. And you may think to yourself, well, we'll go to the emergency room and then we'll tell them we'll call Park Urology and talk to the doctor there. And unfortunately, it just doesn't always work that way. Sometimes they won't call us, or they have called us.
Don't listen to us.
And we tell them, okay, here's what to do. And they go, I'm not comfortable doing that. So lots of words to say. We want you to feel comfortable. It is safe to come here and have surgery. It is safe to go back home. And if there's something that comes up that you're worried about, we are easily accessible. And we just don't want you to rush off to the emergency room, or really to any doctor about something you're worried about, without talking to us first. We want everything to be done in the best way for your child.
And I promise, we've probably seen it before. Whatever your specific question is, and we know and can give you kind of the easiest, most straightforward answer to what to do next.
That's right. And we can also say that in the now 3.5 years that we've been in this practice, the number of times that we've had to call a colleague in another city to say the catheter came out and the child's having trouble peeing or something has been about 2 times. And so it's really rare that there's any kind of situation where we need to assist you and get you in to see somebody else. Fortunately, those things just don't happen. So again, we want to say, feel comfortable coming here, and if there is a concern while you're still in town or once you go back home, you can always contact us, and we want you to.
So we hope that this helps explain a little bit more about what to expect right before surgery, during the surgery time, and in the week or two to follow. But if you have some additional questions or you're not sure about something, then feel free, of course, to email us at our info@parkurology.com, or you can go to our website, www.parcurology.com, for more information. Thanks for joining us.
Okay, bye-bye.